As defined in the introduction, helicopter shopping is the practice of calling in sequence several air medical providers until one will accept the mission. The following is an example of helicopter shopping that resulted in a fatal accident. All information from this accident is taken directly from the NTSB Factual and Probable Cause Report, File CH-104, MA 182. On July 13, 2004, at 05:35 Eastern Daylight Time, a Bell 407 helicopter was on an EMS mission when it collided with trees shortly after takeoff from Interstate Highway I-26 near Newberry, South Carolina. The pilot, flight nurse, flight paramedic, and patient received fatal injuries, and the helicopter was destroyed by impact and post-crash fire. The EMS flight was en route to the medical center where it had departed at 05:02 Eastern Daylight Time. Night vision meteorological conditions with mist and fog prevailed in the area of the accident site. 3 other EMS helicopter operators had turned down the mission, including one who had attempted it but had to return because of fog conditions. The following is taken from an investigator's interview with a pilot who attempted the mission and turned around. On 7/13/04, I was the duty pilot at Care Force 1 EMS helicopter based at Richland Memorial Hospital. At 4:39 a.m., I got a call from Peggy Hansen, our communications specialist, stating that Newberry County EMS 911 dispatch was requesting our services for a scene flight. I accepted the flight based on available information from our company computer-based weather reporting system. At 4:40 a.m., we were put on standby. At 4:42 a.m., we were requested to go to the scene. We lifted for departure at 04:43 a.m. and flew for 2 minutes before I decided to cancel the flight due to halos on some lights in the distance which would signify the formation of fog. I landed back at Richland Hospital at 4:46 a.m. After Care Force 1 aborted the flight, Newberry 911 pursued as follows. At 04:48, Newberry 911 contacted MTC-1 located in Greenville, South Carolina. The MTC-1 dispatcher turned down the flight without contacting the pilot because they were operating in condition red. At 04:49, Newberry 911 contacted LifeReach 1 located in Columbia, South Carolina, to determine if that operator could accept the mission. The LifeReach 1 pilot initially accepted the mission, but declined it when he learned that Care Force had returned due to fog. At 04:50, Newberry 911 contacted Spartanburg 911 dispatch requesting services. The Newberry 911 dispatcher informed the Spartanburg 911 dispatcher that other operators had declined the mission, stating, Greenville couldn't fly 'cause the fog was too bad. Columbia couldn't fly. The Spartanburg 911 dispatcher responded, it may be the same. The Newberry 911 dispatcher continued to provide information about the launch request, never completing her statements about the weather turndowns. At 04:52, as the Spartanburg dispatcher continued to collect information about the launch request, another Spartanburg dispatcher telephoned the accident crew to see if they were able to fly. The accident pilot accepted the mission at about 04:55. Neither Spartanburg 911 dispatcher was aware that Care Force had aborted the mission due to fog, or that LifeReach 1 had turned down the mission, and therefore could not inform the accident pilot of this information. No one wants to lose peers and patients, nor does the air medical community want to see yet another headline like this one in the Indy Star newspaper on February 10, 2006. 2 copter firms turned down run. Despite the fog, a third company agreed to fly the patients to Indy last week and soon crashed. Over the past few years, competing air medical services all over the U.S. have worked together to address the issue of notifying pilots when a flight is turned down for weather in their region. The Air Medical Services in South Carolina developed a statewide notification system shortly after the accident we previously portrayed. There's also a free internet service sponsored by AirMed International, headquartered in Birmingham, Alabama. This website, Weather Turndown. But prevention starts with hospital and pre-hospital personnel who can help to minimize risk of an adverse event caused by helicopter shopping. Hospitals that request air medical transport for inter-facility transfers play a key role and can contribute to the safety culture of the air medical industry in the following ways. First, ensure that the patient meets established and published criteria for air medical transport. Notify any subsequent air medical services contacted that you already called Life Flight, for example, and they could not respond due to weather. Provide specific information, such as time that you called the other service. Have ground transport contingency plans in place so that there are no delays for the patient while trying to access alternative air transport. Weather is an ever-changing phenomenon, and weather reporting is not always accurate. That's why it is important for a pilot to be told that another pilot has declined to take this flight. Communicate each time you call another service of a previous turndown. Educate personnel what to do when a flight is turned down for weather. Simple reminders posted at strategic places in the emergency department or at the 911 center would be helpful. With the help of requesting agencies, the air medical community will be able to respond safely and meet the needs of patients more efficiently. The Commission on Accreditation of Medical Transport Systems, CAMTS, requires each accredited program to develop a policy to discourage helicopter shopping and specifically address how the program interfaces with other air medical programs in the same coverage area to alert them of a weather turndown. 7th edition accreditation standards. The FAA, other national organizations, and state EMS agencies have addressed this issue by creating guidelines and procedures. Competing programs have also collaborated to develop policies to discourage helicopter shopping. The following list represents some of the published guidelines and procedures.